Litigation over cost-sharing reductions continues. We're going to get you an update on where things stand now. But first, let's refresh our memory of what we mean by cost-sharing reductions. It's actually a statutory obligation. That payment comes from the federal government to insurers. The attempt is to reduce the out-of-pocket limit, things like deductibles, other forms of cost-sharing for consumers. Cost savings are passed on from insurers to enrollees in silver plans. It impacts those between 100 and 250% of the federal poverty level and anybody that is an American Indian purchasing marketplace coverage. So it's got this broad impact to bring down out-of-pocket costs. Now, cost-sharing reductions in October of 2017, the administration said, we're not going to reimburse insurers anymore. It was a blanket statement. We're done reimbursing insurers for cost-saving reductions. It was announced on the cusp of open enrollment in 2017, intent to damage the marketplace. It was part of this convoluted effect of chipping away at different parts of the Affordable Care Act to try to destabilize it, to try to get rid of it. A political move more than anything. Of course, the impact of 3 months of no cost-sharing reduction reimbursements to insurers meant, as the insurers claimed, a $2 billion loss in revenue. Many states wouldn't let insurers adjust rates that were already filed, so there was an impact in some states of losing cost-sharing reductions, losing money from the federal government, and not having the ability to make it up in other ways. In other ways means passing it on to consumers in the form of higher premiums. So the impact to Wisconsin instructed insurers to set rates assuming they would not get these payments. So Wisconsin saw an increase in premiums for the last open enrollment period. Wisconsin was one of those states that went ahead and increased the premiums to cover this loss of cost-sharing reduction. So it's really the way that money is coming into the insurer and then how they're passing on that cost savings or that cost to the insured. Now, the impact of cost, of course, is it costs more money. And you know what? The federal government actually ended up paying more in the long run. So let's look at how the math works. If the federal government would have reimbursed insurers for cost-saving reductions, they would have spent X number of money, $2 billion, whatever the dollar amount is. By not making those payments, insurers raised premiums. As premiums go up, so do the tax subsidies to offset those premium increases. The feds actually paid more in the tax subsidies to insurers than they would have paid if they just left cost-sharing reduction overall. So it cost the feds more money because as premiums went up, tax credits went up. So the feds probably paid more in premium tax credits than it saved in not paying cost-sharing reduction payments. Rate hikes hurt those that were not getting tax subsidies most. So some insurance plans increase rates across all plans. People that were over 400% of the federal poverty level that don't get the benefit of tax credits, they were hurt the most. They saw huge increases in their premiums. So as you can imagine, there's legal challenge that got involved. Decision to end payments came out of House versus Azar. District Court ruled no payments of cost-sharing reductions without an explicit congressional appropriation. They said that's fine. You don't have to pay insurance companies for cost-sharing reductions. There's no congressional appropriation that says you have to. That's what came out of the District Court. As you can imagine, some insurers appealed that. Montana Health Co-op and others did not like that. So on September 4th, before that, they went in front of a district judge, federal claims judge, and she actually said otherwise. She said, no. Insurers are entitled to cost-sharing reductions. That's clear in the statute. That's a statutory obligation. What's not clear is where the money comes from. So her argument is insurers are entitled to cost-sharing reductions even without such an appropriation. She cited a case, Moda Health Plan case, as the example of why her reasoning is true, which is a little funny because that's a risk corridor case, another opportunity where the feds have to give money to insurance companies to balance risk among different risk pools. And there's litigation over risk corridor payments as well, operating separately from this litigation. The judge didn't answer some other questions, in her opinion, other questions about contracts between HHS, the feds, and insurance companies, but she did say this is an example where cost-sharing reductions are owed to the insurers. So that's where it stands now. You can bet that's going to get appealed. If you want to read the opinion in Montana Health Co-op versus U.S., you can read it here. You can also send us your question. If you have questions about other market stabilization methods and payments to bring costs down in the marketplace, you can send us a question, and you can do that at healthwatchwisconsin.org.